name's Alyssa. I'll be your nurse today. Can I get your full name?
Katie Mint.
Do you know where you are?
My grandma's house.
Do you know what day it is?
Sunday.
Perfect. Okay, so I'm going to perform hand hygiene. And then today we're just going to be doing a head to toe assessment. I'm just going to be looking at your abdomen, your pulses, your respiratory system, and then your cardiac system. Did you have any questions before we start?
No.
Perfect. Okay, so first I'm just going to look at your pupils. Pupils dilate bilaterally. I'm going to do a confrontation test. Have you look out there. Look at my pen. Eyes accommodate bilaterally. Next, I'm just going to see what size your pupils are. It's probably about a 7. Next thing we're going to do is a strength test. So I'm just going to have you squeeze my hands. Okay, push up on my hands. Okay, so strength is 5 out of 5 in hands and legs. Next, we're going to be looking at your thoracic cavity. So I'm just going to take a look at your thorax. Looks oval. Want to do confrontation. And then I'm going to check for oxygenation, perfusion, and then make sure that you don't have any edema. So first I'm going to look at your fingertips. They are not blue, so there's no sign of stenosis. Then I'm going to check for capillary refill. So I'm just going to go, finger nail beds are pink. Okay, capillary refill is less than 2 seconds on each hand. And then I'm just going to check for edema. So I'm just going to squeeze your arms and squeeze your lower legs and your feet. Okay, temperature is normal and there's no sign of edema. Next, I'm going to do, I'm just going to palpate your thoracic wall. So just let me know if there's any pain. I'm doing this. Any pain there? Okay, so we're going to do respiratory expansion. So I'm going to have you stand up for me. And I'm just going to lift your shirt up. If you want to hold it kind of so it doesn't. There you go. You can just relax. Okay, and then I'm just going to put my hands here. Can you hold it? Just hold it. There. Okay. So I'm just going to put my hands here. I'm going to have you take a deep breath. Okay, so hands raised bilaterally. Next, I'm going to listen to your breath sounds. So I'm going to have to go under your shirt for this, but every time I move my stethoscope, just take a deep breath, okay? I'm going to go underneath for this one. Okay, and then we're going to do the lateral. Other side. Okay, and then we're going to do your back. Perfect. Okay. So breath sounds sounded normal, didn't hear any abnormalities. Next, we are going to oscillate your cardiac system. So I'm going to do your carotid first, and then we'll have you lay down from there. So I'm going to use the bell of my stethoscope. do the other side. Okay, sounds good. I'll have you lay down. Didn't hear any bruits or anything out of the ordinary. Okay, so I'm gonna go back to my diaphragm. First one we're gonna be listening to is the aortic. This is the right sternal border, second intercostal space. So we're just gonna find that. Okay, then we're gonna do the pulmonic, right sternal border, second intercostal space. Okay, we're gonna do Erb's point, left sternal border, third intercostal space. Okay, I'm gonna go underneath for this one. This will be the tricuspid. It'll be right sternal border, fifth intercostal space. And then mitral will be subclavicular line, middle subclavicular line, and then fifth sternal costal space. Okay, and then next we're just gonna listen to your apical pulse for 1 minute. So I'm going to just find that here. Okay, so about 88 beats per minute. Okay, next we're gonna just check your different pulses. So the first one we're gonna do is your carotid pulse. So I'm just gonna do one side at a time. Okay, 2+ bilaterally. Then we're gonna do your brachial. 2+ bilaterally. We're gonna do your radial. 2+ bilaterally. We're gonna do your femoral. 2+ bilaterally. We're gonna do your popliteal. 2+ bilaterally. We're gonna do your posterior tibial. 2+ bilaterally, and then we'll do your duralis pedis. 2+ bilateral. Perfect. Okay, so next we're going to do your abdomen. So first thing I'm going to do is just palpate. So actually I'm going to oscillate first. So I'm going to listen to your stomach sounds in each quadrant. So first I'm just going to start in the right lower quadrant and listen to 2 places in each quadrant. Okay, bowel sounds were heard in all 3 quadrants. I would also check to make sure that the stomach is flat, and then also if there was any scars, lesions, bruising, anything like that. Next, I'm going to percuss the abdomen. So I'm just going to do it 2 spots in each quadrant. I should hear tympani. Okay, sounds good. I heard tympani in all 4 quadrants. And then last thing we're going to do is just palpate. So I'm going to start 1 to 2 inches. Let me know if there's any discomfort, okay? That hurt at all? Okay, so then we're going to do 5 to 8 inches. So I'm going to push a little deeper. Okay, everything seems normal. I didn't feel any masses or bumps while palpating. So that wraps up our head to toe assessment. Do you have any questions at all?
No.
Okay, well, thank you for your cooperation, and that is all for today.